Welcome everybody again. PSR Texas is very thrilled to have our board president doing our first presentation of the CME series. Adelita, would you like to kick us off?
Sure. I'm going to go ahead and share my screen there.
I think it had been, but Sylvia, were you sharing, or do you want Adelita to? There we go. Okay.
You're seeing my screen?
Seeing your screen and also seeing the slides coming up. So
okay.
There we go. Perfect.
All right.
All right.
Then we'll go ahead and get started. Good evening, everybody. Thank you for joining us this evening. My name is Adelita Cantu. I'm a professor at the School of Nursing in San Antonio at UT Health San Antonio. I am also chair of the Texas Physicians for Social Responsibility, as Marge was saying. And I am also a board member of the Alliance of Nurses for Healthy Environments. And the PSR National and certainly the state PSR, and also, as like I said, a board member of the Alliance of Nurses for Healthy Environments, and both of our organizations collaborate so many times in the past and as well as the future going on. So glad to be part of both of those organizations. As I said, I am a professor at the University of Texas Health Science Center. My background, my expertise is as a public health nursing. My research involves health promotion in the community using the social ecological model. And with that, I specialize in health literacy strategies to promote health, as well as, of course, environmental health and all aspects of environmental health that impact the people that we see. I have no relevant financial disclosures. And just a little bit about Texas PSR. Just wanted to say that we're an organization of physicians, nurses, and concerned citizens. We're all committed to a safe, healthy environment for all of Texas. This is the Texas chapter of the National Physicians for Social Responsibility. Of course, we are guided by expertise, both medical and public health. And we work in partnership also with national, with the other chapters that we have around the country. And we do that by understanding some of those threats to health and survival through outreach, education, and advocacy. And on the bottom of the screen, I have the link for our newsletter, the Texas PSR newsletter that comes out on a monthly basis and has some great information and great resources. So let me get started for this evening, and just to also say that I'm pretty freewheeling. If you've got questions or comments, Marge and Sylvia will be watching the chat box, or if somebody wants to unmute and have a discussion as well, please take do that if you need to. So our learning objectives for today. First of all, we want to define PFAS and what we call the forever chemicals, and identify their common uses and sources of where we find them in our consumer and industrial products. Also, we want to discuss potential health risk, of course, associated with this exposure, and what are some of those actionable steps that we as individuals and consumers can take, but also how organizations and providers, health professionals can also take to support a healthy environment, one that has limited exposure to PFAS or forever chemicals. So I want to start this story by focusing on Paracelsus, who was a physician back in the 15th century. And he is quoted as saying, "All substances are poison, but there is none which is not there is none that is not a poison. The right dose differentiates a poison." And in general, the greater the amount of substance that enters your body, the greater is the effect on your body, right? I mean, that makes sense. So this connection between the amount and the effect is called that dose-response relationship, which all of you are familiar with. But also, there are critical windows of vulnerability for exposures to not be as healthy for us. So those critical windows of exposures, and we'll be talking about those throughout the session this evening, but there are periods during which, during life, when an exposure causes a stronger deficit in health later in life. So as you're growing inside the womb, or during as an infant and childhood, there are these critical windows when we really, really need to consider the exposures that we're having because of the impact it has for us later in life. And so Paracelsus was a pioneer in several aspects of the medical revolution, and he was very, very far thinking in his involvement in medicine, and that not only did we have to think about medicine, but also the use of observation and what's going around a particular person. Of course, in the 15th century, it's different than what it is now, but the whole idea is knowing the environment is also important to understand the condition that a person has. So this brings us to our topic of synthetic chemicals, or chemicals that are man-made. So just some interesting information about chemicals in use today. We're routinely exposed to toxic chemicals in the air we breathe, the water we drink, products that we use, food that we eat. The EPA has estimated there are over 40,000 man-made chemicals in products that we use today, but only 1% have been tested for safety in human use. So when there was the policy that was developed in the 70s, the toxic substance abuse policy, every chemical before that was grandfathered in. They never went back to test those chemicals that were already around us. Going forward, recently in the 21st century, that policy has been updated, but again, it is very limited in the number of chemicals that are actually tested for safety in terms of human use. Big industry, chemical industry, 640 billion on a yearly basis. And we're routinely exposed to chemicals that have not been banned in the United States, but have been banned in places in Europe. And chemicals are all around us. They're ubiquitous on everything we touch, everything we breathe in, etc. So that then takes us to our story of PFAS. And it starts with an accidental discovery, actually. In 1938, Dr. Roy Plunkett was working with gases that were related to refrigerants. After checking a frozen compressed sample of tetrafluoroethylene, he and his associates made an unexpected discovery. So the sample had polymerized spontaneously into a white waxy solid to form what we now know as PTFE, or polytetrafluoroethylene. So this was sold because of its ability to be water resistant, to be very durable. And this became what we now know as Teflon, the nonstick pans. It was first trademarked in 1946 to have products sold with the coating, the PTFE coating on it, and what we know of as basically Teflon. Coating in cookware, soil and stain repellent for fabrics, textile products. Superior very much in its coating in harsh manufacturing environments and industrial products. That's what made it so durable. And so out of that came per our polyfluoroalkyl substances, what we now know as PFAS, and that's what we call forever chemicals. And the reason we do that is they're very, very hard to disintegrate and degrade. So they're forever in the atmosphere and the environment. There are actually 12,000 chemicals in this class. They're very stable and resistance to our typical environmental degradation in soil and rains, everything else. So it's very, very resistant to degradation, and it persists in water and soil. And therefore, it impacts the foods that we get from water and our soil as well. There's a strong bond between carbon and fluorine, but very good at repelling dirt, grease, water. Its resistance to high temperatures as well. Think about your Teflon and your pans. And it acts as a lubricant as well. So again, it's all around us. And on the right of the screen, you can see like all the substances that are utilizing PFAS. Raincoats, nonstick pans, of course, the Scotch Guard, the spray that you put on any suede to protect the suede, Post-it notes, actually, then stain-resistant carpeting as well. Anything that's stain-resistant, including clothes and everything else, was coated with this chemical. So it seemed like a good idea at the time because of its convenience. And this is just a graphic to show you the chemical structure of PFAS, why it is so hard to break down because of all the different carbons and fluorine there. And you see that the carbon at the center can be very, very strong. So just terminology, not important to our discussion today, but just to have this out there, there is long chain versus short chain. And the one on the left, the long chain, is important to consider because we're going to talk later on about some of the chemicals or PFAS chemicals that have been banned or discontinued here in the United States. And most of them have been that long chain PFAS. Whereas the short chain were some of the new generation of chemicals that were introduced. And now some of that has been discontinued or banned as well. So PFAS, the ones that are well known, PFOA, PFOS, and PFH times 5. This is important because this is what's really was found in firefighting foam. And when we talk about some of the health impacts, you can think about how some of those health impacts have very much burdened our firefighters because of this firefighting foam. But not only that, because it's in the foam. So when the firemen are dealing with a fire and they put all this foam is on the ground, it seeps into the water, it seeps into the soil, which then impacts us all. And what products? We talked about some, but here are others. The lining of food containers, microwave popcorn, some of the fast food containers, those resistant to grease, you can think of as having chemical coating on it. Nail polish, some of the nail polish that we use, of course, the water-resistant clothing, shampoo, why it's important to look at the shampoos that we do use or personal care products to see if they do have any PFAS within that. Candy wrappers, all of those, again, they're ubiquitous. It's all around us. Okay, so how are we exposed to PFAS? Just a visual here to let you know that from consumer products, if they're in a consumer products, then we're exposed to them. But also if they're in the food and drinking water, just like the runoff from the firefighting foam, that also leads to human exposure as well. If they are in industry creates the products that also impacts humans. As you see, the industry can also put waste into the environment that contain the chemicals, and I'll talk about a case study on that. Firefighting foam, and all those different routes we could be exposed to these chemicals. So many different ways. So what's the problem with it? Well, for one thing, it's persistent in the environment, and it's very mobile. It will move quickly, particularly if it's in the foam and the runoff and gets into the water. So it's very mobile. It goes with that runoff. But we do know that it's toxic at extremely low levels per trillion. So it does not take a whole bunch where that accumulates for us to be exposed, as well as that exposure leading to some negative impacts. It bioaccumulates, and by that I mean it accumulates in our systems, in our organs. So it bioaccumulates, and it also biomagnifies in organisms. By magnifying, an example would be that it's in the water. It would be in the water, and then we're eating fish that come out of that water. So then it goes upstream to expose us all. So it's biomagnifying in the organisms as well. And it's linked to many health problems that I'll make the case and talk about that in a bit. And if we look at the history, okay, remember when I talked about the, in 1930s, it was invented or was found. It was the 1930s where Teflon was invented and then patented. In 1940s, it began at the production at 3M plants in Minnesota. Remember that the chemical is in the Post-it notes, so we see it there. That took us into the 1950s, where it was put in stain and water-resistant products. And it wasn't until the 1960s that DuPont started raising concerns relative to health risk relative to PFAS. But it was done in an internal document, not for the public. It was done in an internal document, and that was in the 1960s. So it really had been on the market over 20 years. As you can see here, in 1978, unpublished study shows adverse effects in monkeys. 1980, it was detected in the serum of workers, industrial workers in particular. 1981, concerns about birth defects, in children born to women workers in that industry. And so you see it was, and then in 1993, 3M begins to monitor their chemical exposure in their workers. 1998, samples from U.S. Blood donors were shown to have PFAS in them. And this takes us all the way with the latest in 2012, where immune system effects related to PFAS reported in children. In 2004, DuPont actually settled a class action lawsuit of $343 million that funded some more health studies, and I'll talk about those in a little bit. So, looking at this timeline, see how long this, just the 20 years that it had been in the environment without any health impacts, at least reported. And remember, these are forever chemicals. So even in those 20 years, we're looking at things that are happening now that are related to PFAS, which actually were exposed to in 1930s, 1940s. It just is very persistent in the environment. Now, talked about PFAS contamination. Here's just a visual of a map, and this was in last year, 2024. As you can see, it's drinking water. In the drinking water in a large portion of the United States, and the light blue is above proposed limit. And as you can see here on military sites, which use a lot of the products, the consumer products and the industrial products that had PFAS in them. So many of these military sites have been cited as having PFAS exposure to the civilians and military in there. So it is a very pervasive and ubiquitous issue. Now, remember I talked about the class action suit. And I don't know if anybody has ever seen the movie, and it's streaming on Netflix, called Dark Waters. It is based on a true story from this lawyer, Roy Byla is his name, and he was actually made partner at a large law firm, I believe it was in Chicago, and when he received a call on his direct line from a cattle farmer, the farmer, Wilbert Tennant of West Virginia, said that his cows were dying left and right. He believed that the DuPont chemical factory, which until recently operated a site in Parkersburg nearby, or in West Virginia, and that actually was 35 35 times the size of the Pentagon. So as you can see, it was a very, very large factory that was disposing of waste in the waters that the cattle drank and other wildlife drank. And this farmer was experiencing cattle that were dying left and right, from what he said. So after a lot of work in this movie, Dark Waters really highlights all the intensive work that the lawyer did to uncover that internal document from DuPont as well as other documentation of the health impacts, led to a class action lawsuit that they won. And that class action lawsuit actually funded this study, large study. As you can see here, almost 70,000 was a sample size. And they looked at 2005, 2006 that were exposed to water contamination with PFAS, PFAS C8 in them. And as you can see from this sample, there were higher levels of kidney cancer, testicular cancer, ulcerative colitis, thyroid disease, high cholesterol, and pregnancy-related hypertension. And all of these conditions were shown to be associated with the higher level of exposures these individuals experienced. It's a very good movie. I do highly recommend it. I saw it was streaming on Netflix. And so PFAS became known as a multi-system toxicant. So not only was it the kidney, but the kidney then affected other things. But because the kidneys affect all the other systems in the body, just like the immune system affects so many different things in the body. So there was not one thing that you can say, the kidney didn't, it was not one system that you could say only it was negatively impacted by PFAS. It was the whole system. As you see here, it was everywhere. So this consensus study of PFAS, and this was in 2022, so fairly recently, came out and found that there was sufficient evidence for elevated cholesterol levels. And you think about your practice and the people that you see and how many people are on high cholesterol. Of course, we know it's associated with our diet as well, but even in children, we're shown to have sufficient evidence for that. Then kidney cancer in adults, decreased infant and fetal growth, and decreased antibody response, both in adults and children. Again, impacting the immune system. And then, of course, with all the infectious diseases that we have now and people not getting the vaccines that they did before, and the PFAS exposure can minimize the immune response that you would have to a different virus or bacteria. There is also suggestive evidence for increased risk of testicular cancer, pregnancy-related hypertension, which is preeclampsia, ulcerative colitis, like I said, thyroid disease, breast cancer, and liver enzyme alterations. So as you can see, there was a consensus that this exposure was had significant or sufficient evidence to show that it was having a negative health impact for adults, particularly with a higher dosage or exposure, I should say. Also, this could be, as I said, the immune response becomes lessened or can be shown to have a negative impact. We just were in COVID during the pandemic. Again, higher levels of PFAS were shown to be increased in people that were in the ICU or deceased because of COVID-19. Now, of course, that you always have to see were they vaccinated or not, but there was an association between higher blood levels of this and worse COVID outcomes as well. Why are children more susceptible? Remember, I talked about the critical windows that we have. Why are children more susceptible? Well, it's different absorption, metabolism. Everybody's aware, we're all aware of that. Children metabolize, absorb things differently. And all organs are growing rapidly for our children. And again, we know that with our own children. They tend to drink more water in proportion to body weight. And again, water contamination of PFAS will have a big impact on this. We also, as an infant, mix the formula with water, and if that's not, that water is also contaminated. So again, they can be exposed to much more water in proportion. They have a faster respiration rate, so things that are in the air, they bring them into their lungs. And of course, then they have the longer lifespan. They're in childhood. There's going to be a longer lifespan and more chances to have negative impacts as they age into adulthood. So that's definitely one of those critical windows. At prenatal then, likely scenarios that they interfere with the programming that occurs during later life. So this is a critical window as a fetus is developing inside the womb. The American Academy of Pediatrics, children also have unique vulnerabilities to environmental exposures, which PFAS exposure is one, because of all those different things like I showed you in the last slide, different metabolism, the body structure, daily behavior, lifestyle. Kids are, infants put things in their mouth. They're exposed to many more things by just putting things in their mouth. So again, many ways that it can be exposed in childhood. Then during puberty, adolescence, these chemical exposures can again bioaccumulate, be passed to the baby during pregnancy, or breastfeeding as well. Even with that passive immunity we get from breastfeeding, there could also be some harmful exposures that are passed on to the infant during that time as well. So what puts you at greater risk of exposure? And as providers, do we see our patients during those times of critical windows? So pediatricians, OBGYN, family medicine. Think about fetus, infants, and children being one of those critical windows. People that have underlying health issues in which their immune response may be lessened to begin with because of these underlying health issues, and you put exposures with that, chemical exposures, PFAS exposures, then the negative impacts can be even greater. Then we have certain occupations. Remember, we talked about firefighters and their exposure with the firefighting foam. And then we also have plant workers, industry workers, where PFAS chemicals are being used and developed for consumer products as well. So these workers are going to be even more vulnerable to those negative levels of exposure, higher levels of exposure, I should say. And where you live. Do you know your community, the community in which you practice? What are the lead levels, or not lead levels, I'm sorry, the PFAS levels in that drinking water? And those are available at the website for your municipal water system. They would list the chemicals or the contaminants in the water. So knowing your community, knowing what the water source is very important as well, particularly if you're practicing with people during those critical windows of exposure. And now I just wanted to put this out here as well, because I am speaking to you from South Texas. And in South Texas, as well as other parts of Texas, we have communities in which there is quite a number of fracking going on, the bringing up of cracking of the shell underground, bringing up any oil and gas from the ground, and that is done through high pressured water used to break up the shell. And as you can see here, disclosed use in fracking of PFAS and possible PFAS in New Mexico oil and gas wells. So again, if that is used in the water that's used to break up the soil in the ground, and if any of that water then leaches to any of the water system, many of this is done in rural communities, and that can leach into the well water where people may use that water. That will be their water source. So fracking is also puts people in that area, that increases their vulnerability to this exposure as well. This is a report that was done by National PSR about fracking with forever chemicals. This was in New Mexico. And the issue too with many of the industries that do fracking, many of the things that they put in their water are proprietary information. So sometimes that is not disclosed as well. So again, it's just something that we need to be aware of. And so, having the discussion of what can you do as a provider, as a nurse who is talking to people in the community, advocating for people in the community, advocating for your patients. Well, first of all, is there testing available? If we want to suggest testing, or if you as a provider want to order testing, there is a clinical reference blood test for PFAS exposure. It may not be widely accessible, however, has limitations in interpreting exposure timelines, so it can't tell you when you were exposed and how long ago you were exposed, and the potential health risk due to lack of established reference ranges with specific PFAS levels. So ordering that blood test or doing that blood test is also understanding what some of the caveats may be in terms of what it really does tell you and tell that person as well. There's a benefit is if there's an individual with suspected high exposure to PFAS, such as those living near a contaminated site or with occupational exposure, firefighter, industrial worker, etc. And people that may be concerned about potential health impacts or effects related to PFAS exposure as well. So just some information, there is a blood test available, clinical reference test. It is limiting in what it can say, but it may be of benefit if that person is someone who would like that information. The PFAS toxicity is not associated with characteristic signs or symptoms. Other than what I told you in terms of what that study, the consensus study found, there is no prevailing characteristic sign or symptom for it. And again, that's what makes it really, really difficult to know what some of those negative health impacts may be. Now, patients with concerns about PFAS can present with a known exposure and be asymptomatic. They may have signs or symptoms or a diagnosis of a disease or health issue, like that high cholesterol, or they may live in a community with exposure concerns but not know if they were exposed. Somebody with high cholesterol who reports that, what they're eating and they're a very well-rounded diet, but yet have high cholesterol. This may be something that you also want to consider in that a differential diagnosis and see what does that PFAS level look like if there's a blood test that's available for you to use. Also, doing an exposure history would be helpful. First of all, with water, dietary, consumer product exposure, contaminated drinking water. Are they exposed to well water? Do they have a private well? So many providers in the rural community, this is something you may want to consider as an exposure history if there is a private well there. Fish from contaminated water. Food wrapped or contained in grease-resistant paper or packaging. And then any of the PFAS containing consumer products that I mentioned earlier in the slides. Now, do they live near to places that may manufacture, handle, or use PFAS? Factories, we've talked about those industries, but also airports. Airports, you remember that flame-resistant foam that is used? It could be also used in airports, but also airports are vulnerable because they use many of those water-resistant coatings. And again, airports are in the middle of cities. Military bases are also in the middle of cities, so you have to think about those as possible exposures. Wastewater treatment plants. And many of those wastewater treatment plants are in some of the very vulnerable and low-income parts of a community. And so again, even more exposure to people that are already vulnerable. Farms where sewage sludge was used for fertilizer, the landfills, and incinerators. So taking that exposure history, accounting for all of these also may give you some additional information. So we talked a bit about water and the water having PFAS, forever chemicals in them. So as a provider, this may be a question you would get from your patients. Should I use tap water or bottled water? Which is best? Well, there are many, many resources out there. I put in on the left of the screen the Environmental Working Group and their guide to safe drinking water. Learn more about what's in your tap water. Like I said, the municipal water company that you use, that is in your community, they should have on their website what's in their tap water. And I'll talk a little bit more about filtering, but is it also filtered tap water? Choose a filter is also something we might want to suggest to our patients and the people we care for. Particularly at the very critical time of pregnant women and infants, safe water is essential. Water is essential. Clean and healthy water is at that critical window. Think about all the ways that our water is being used, and the use of a filtered tap water may be an option for them. So how do you know if your drinking water is safe from forever chemicals? Your city tap water, what it has inside it, what are things that are listed as chemicals that are in your water supply. But I did want to take a little bit of time to talk about the two most recommended types of filter. Granular activated carbon, or what we call solid carbon block filters, are a relatively low cost option. So these are going to filter out those carbon molecules within the water. So it's just acting as that filter. And these are fairly low cost. There's also filters that are called reverse osmosis, which is considered the most effective technology for removing a wide range of PFAS, including those short chain ones as well, and not just the long chain one, the short chain one. So that is another type of filter that could be recommended to your patients, to your community as well. This is coming off of I talked about, I'm on the board of the Alliance of Nurses for Healthy Environment, and the website is on the bottom of this. And these are resources for you as providers that you can access and download these types of brochures that give people some information about what are PFAS, what are they, and how are you exposed to them, and what is your risk, and how we can all work together to advocate, first of all, eliminating PFAS as much as possible, and then understanding what the health impacts of PFAS may be in adults, in children, in infants, and in pregnant people, preeclampsia for sure. The National Academy of Medicine has these types of resources as well, but they're all available. You can just download them. Have them in your office, pass them out in the community for people to inquire, to become aware, and maybe to ask more questions for you about them. Now, we do have some good news. So I want to leave you with some of the good news. So this is an update from April 10 of last year, so almost a year. The EPA finalized unprecedented new limits on the toxic forever chemicals as a way to tackle drinking water contamination. So the proposal targets 6 of those PFAS, PFOA, and also remember that on the right side of that screen, Gen X, again, that was one of the newer chemicals that came out that was supposedly not as toxic. But as you can see here, this is also going to be limited or at least finalized with the EPA. These are among the most protective health limits on PFAS in drinking water in the world. Texas has also come to the way of thinking that PFAS can be very toxic as well. So hopefully that we continue at the national level as well as at the state level to understand what PFAS are and how it does impact our health. So that's good news. But there's also good news from McDonald's, one of our favorite fast food places, or at least a lot of people's favorite fast food places. 2021, they announced a global ban on utilizing PFAS to coat their food packaging. And Burger King and Chick-fil-A have gone along with that. So by 2025, they all three should not have any PFAS in their packaging any longer because of the recognition of those toxic health impacts. 2020, 7-Eleven disclosed on its website that it began replacing the packaging with PFAS coatings with alternatives like molded fiber clamshells. And those clamshells now that we see at the grocery store, those clamshells are now being used rather than things that require that type of packaging to resist grease and other coatings as well. So really, really good news in that respect. In more good news, February 2024, FDA announced that substances containing PFAS using grease-proofing agents on paper and paperboard for products are no longer being sold by manufacturers. Home Depot, one of the world's largest home improvement retailer, a lot of carpeting, that water resistance, but it actually now announced that it will phase out the sale of all carpets and rugs containing that. The company will stop purchasing for distribution any carpets, rugs, and that was in 2019. So as you go into Home Depot now, that is completely gone from their carpet selections. And then Starbucks. We're all at Starbucks committed in 2022 to eliminate PFAS by the end of 22 and internationally by 2023. So all of these groups that I had talked about that are advocating, the Alliance of Nurses for a Healthy Environment, the Environmental Working Group, National PSR, Texas PSR, all of the advocacy that we've been doing in terms of informing our policy and our policymakers about the dangers of PFAS and its toxic levels in our environment and in the people that we care for has made a difference. These are industries that are leading the way in eliminating PFAS from their products. Other things that you can tell the patients in your community: use stainless steel, cast iron cookware. Just get rid of nonstick pots and pans. Treat carpeting, furniture, no stain-resistant sprays to protect suede or anything like that. Leave shoes at the door to minimize dirt, clean spills as they happen. If you have furniture or carpet professionally cleaned, opt for steam cleaning with fragrance-free water-based cleansers. Any type of stain treatment after that, do away with that. Making your own popcorn, not using the bags of popcorn because of that grease resistant there. Buying safer cosmetics. Here's again, the Environmental Working Group. Teflon is in foundation, sunscreen, moisturizer, eyeshadow, all of those products. The Environmental Working Group does have a link on their website called Skin Deep. And anybody, it's an app, you can download it on your phone. And when you're in the grocery store wanting to buy something, you can just scan the code and it will give you whether it's a hazardous product or not based on the chemicals it has in it. So again, a lot of information out there for people to raise their awareness of their exposure. In-home water treatment filters, as we've talked about. And then just avoid eating fish, particularly from waterways impacted by PFAS. Freshwater fish, again, just the recommendation to either do away with it or severely limit the fish that you eat that may be considered freshwater fish. Uh, and then, of course, fish advisories in any of the lakes that you have nearby that people may fish at also are going to have a list of chemicals or things that are in the water there. But again, on the whole, I would say freshwater fish you would want to avoid as much as possible. And this is places where it's found. You see some of that is in Texas, but particularly in the eastern part of the United States. Again, fresh water is really where you want to be very cautious. And let's see, I'm a little over 7:46. I'm glad. Okay, here are some credible sources of information. I did check to be sure these are live links, places where you can get information about PFAS, responsible purchasing. As I said, the Environmental Working Group has this database called Skin Deep. There's other databases out there, but I use this one, Skin Deep. Just scan the code and it'll give it a number, whether the higher the number is, the more hazardous the product is, where the cleaner it is, the less the number would be. Green Science Policy Institute has a lot of information about PFAS, free products that you can utilize, as well as references that you can give to the patients or communities that you care for. Okay, I am going to stop sharing my screen if I can, Marge, and open it up for questions and comments.
Terrific. Thank you so much, Adelita. That was an amazing overview in 45 minutes. That was really great.
I tried to leave some time for discussion.
Yeah, you betcha. I'm going to get a couple of the comments, and then we've got some folks raising their hands, which is great. So both Elizabeth and Pam mentioned the firefighters' protective clothing. So Pam's comment was, there was a recent study of firefighters' protective clothing, and was this also PFAS? I had asked some questions of firefighters, chiefs at their respective facilities at the time, and they were not too concerned because there is not an alternative to their protective clothing at this time. Do you know, was the firefighter clothing, did that have PFAS?
That does have PFAS in them, and I guess it speaks to maybe, I don't know if it's a lack of advocacy, that not pushing the chemical companies to come up with something different to protect our firefighters, that protect us. But it is increasing their exposure, and firefighters are exposed to so many things, certainly in the air, but these chemical exposures they have are also going to be very, very critical.
Okay.
Good question. Yeah.
Lisa Doggett, come off mute. You can have the next question.
Excellent talk. Thank you so much. I really enjoyed it and learned a lot. Curious what you do personally as a result of your research and diving into this more. What changes have you made? This is a struggle that I have a lot, and certainly with my family too.
Sure, that's a great question, because it is a challenge. I mean, it's ubiquitous, right? They're everywhere, and we really have to raise our awareness. And I am not completely there, for sure, not completely there. But one of the things I do is a filter. The tap water filter, and I use reverse osmosis. I know it can be a little bit more costly, a higher income, but that is one quick and simple way that people can reduce their exposure to it with filters. The second thing is I only try to go to restaurants or like the fast food, which have made that commitment. I have also ensured that my husband's not getting something from someone else, to reducing their exposure. I've done away with Teflon pans, nonstick pans as well. Yep. And I know that can be a little bit more time consuming because of the cleanliness that goes on there. So you're giving up some convenience, but it's also helped me be a better, and I'm not a great cook, but it's helping me be a better cook in immediately putting the pan in water, letting it soak, and and instead of letting it sit there overnight. So
Yeah.
little changes, and the raincoats. That is one thing too. My raincoat is not chemically coated. I use a raincoat from Eileen Fisher. Again, the products that she uses for her clothes make the clothes a bit more expensive. But again, there are some ways that you can reduce. I think it's almost impossible to say you can get rid of it 100%. I don't know, Lisa, if that answers it.
Well,
yeah, no, that was
Adelita,
great. Thank you.
the only way to get rid of it 100% is advocacy. So
advocacy.
Join PSR Texas, and we will make it advocacy easy for you. And
it does. I was just going to say it does work. I mean, look at the companies that are making that commitment.
Absolutely. Absolutely. I was really taken by a question Pam had said, which is, so how do we help when the persons most exposed are not acting concerned, and there's not an alternative to their protective clothing or other protective, like, young parents, pregnant women, like where that ubiquitous chemical is going to have a new lifetime of impact, right?
Yeah.
How do you talk to patients? How do you talk to the people you work with?
Yeah, great question, because I struggle with that with all health promotion education I do in the community. And I think certainly it is important, and I try to do this all the time, is we have to validate where they're at. And they're busy, they're working 2 jobs, they have 2 other kids. I mean, I just don't have the time, and I can validate that. That is very, very true. And then if this is something that you want us to continue having a discussion about, let's both of us figure out ways that you can reduce some of the exposure. Because particularly with parents, I mean, they are concerned, they want their children to be healthy. And that's my goal as well. And we start from there. And it's unrealistic to say they're going to be doing away with everything. But here are some resources. Like I said, skin deep, buying some products, be aware of it. And then, as you say, advocacy, because there are things that we can do that can advocate for them to make it easier for them to make that decision.
Yeah. Very good. Very good. Elizabeth, you have your hand up.
Yes, I had another question. I wanted to ask about children's clothing and also furniture, and if the covers that we can order for furniture that we purchase, because I think that many times the furniture we purchase does have fireproof fabric or covering on it. And so can we have a place where we can order PFA-free covers to cover that furniture? And the other thing I wanted to say is that oftentimes information like, for example, the firefighter, well, what are the alternatives? So they go ahead and wear the fireproof clothing. But many times the market decides. If people would start to develop and market and advertise PFA-free clothing, children's clothing, adult clothing, furniture, etc., many times people will move to the alternatives. So in addition to telling them and warning them of the dangers of PFAs, it may be more effective or just as effective to at the same time say, here are your alternatives. And I'm happy to see that Adelita has included some of those alternatives and information sites in her presentation. But to put that out there for people so they have alternatives, I think would be helpful.
And hello, Sister Elizabeth, how are you? And your question about children's clothing, manufacturers, because of the PFAS, those should be totally removed from children's clothing now. There's no flame retardant in them. And there doesn't really need to be any flame retardant in them, and there is no flame retardant in them because of what we know of the exposures now and some of the advocacy that's come around children. So that's one way. That's one good thing, that parents, as they're buying the clothes, don't have to think about it. Anything flame retardant would not be in there. And your other question was about flame retardant for fire. No, there was furniture. You said something about furniture.
Furniture,
Yes.
Yeah.
Furniture, yeah, and that's where manufacturers like Home Depot are very important and are leading the way, because you want furniture that does not have that coating that would be resistant to water, because that top coating is what's going to be the exposure that you have as you touch it, as you know, through your skin, absorbing through your skin. So that's another way. So again, just needing to be really, really cautious. And there are, again, industries leading the way. IKEA is a company that does not have use PFAS. However, I know they are expensive, but again, leading the way.
Yeah, yeah,
Mhm.
that's
Yeah.
fantastic.
Yeah.
There are a number of questions about filters in the house. So we'll
Mhm.
take this as your final question.
Okay.
So like the filters on the fridge filter, does that take out the PFAS? The in-home under the sink filters, does that take out the PFAS? Do we know that? Or do we have a resource where we can send people to look?
That is a very good question. I never thought about the filter in the refrigerator that's already there, but I'm talking about the filters in the sink for the tap
Right.
water. But that's a really good question about the refrigerator. I'm going to say we definitely will get back with this group, Marge, if that's okay, when I can research that. I would think there is a filter there, but I need to confirm that. That's a really great question.
Okay. And so the one under the sink we think does take out the PFAS? Okay.
Right. The carbons, it filters those long carbon strains out. So the filters are very good.
Okay, great. So, and we will just,
yeah. I was just going to say, if certainly with it as a provider, if you do take care of children or have particularly infants, particularly bottle fed, I mean, they're going to have so much tap water that they're going to be utilizing. Filters are a very, very, very healthy alternative.
Great, great. Well, I think as my grandmother used to say, you have to eat a barrel of dirt before you die, which we took that as you literally have to eat a barrel of dirt. I think we need to embrace the mess, let the spills happen, you know, and stop thinking that we can have furniture and clothing that somehow makes us look, you know, disaster proof when, you know, disasters happen. So I'm all for my grandmother's favorite saying. So Dr. Cantu, I want to just thank you so much both for your amazing presentation. We will make sure everybody gets slides and a link to the video, also for your tremendous leadership of PSR Texas. We really appreciate that. And we really appreciate Sylvia being on here, who's in charge of all things CME. So if you're looking for some CME for this webinar, you will get that information as well. So we will be in touch with everybody. Thank you all so much for spending your hour with us.
Thank you.
Okay.
Bye-bye.
Thank
Good
you.
night.
Thank you. All right. Thank you so much, everybody. Bye-bye.